It
Oh,
does.
it does.
It stimulates a kind of intelligence in the fascia that it doesn't normally get stimulated to do.
Yeah, I think fascia has.
It wants to do this, but you're actually stimulating the opposite, which is the extension side of it, out of fetal position.
Yeah, and as long as you feel safe, then it'll open. If you don't feel safe, it won't open.
That's the interesting aspect of this, is safety.
Yeah, so it's kind of like I've seen slow motion videos of someone catching a ball, and like what happens to the fascia is you're in a microsecond. Our fascia is kind of like our armor as well. And so in a microsecond, bam, you don't want soft hand to hit that ball, then you're gonna get a big bruise, right? So you want to grab it. So in a microsecond, your fascia can harden like a suit of armor. So if something is stressing you out, imagine how hard the fascia feels to someone like me, a massage therapist. People come in all the time, super stressed out. Their pain body is lit up. They've got their armor on, they've got their shield on. And if I can help facilitate a conversation with them, it's absolutely out of my scope of practice to give them any kind of advice. So if they sit on my couch and they tell me a problem that they're having that doesn't relate to massage therapy, but I actually listen to them and I just listen to them. I'm not giving them advice. I'm just really like sincerely caring about that person and listening to them. Their nervous system will relax most times, more than not. Their nervous system will relax, and that suit of armor I was just talking about starts to soften. Their body makes a decision before their mind does. If I'm trustworthy enough for them to get onto my table and take their clothes off. This is a very intimate offering. Like there's a lot of unearned intimacy. There's a lot of things when you go and receive a massage that are unsaid. Your nervous system is scanning the room. Your nervous system is like, what was that noise? I've never been here before. Who is that person? Are they qualified? Are they going to be warm and friendly? We feel if people have good intentions towards us, whether or not we can, what do you call it? Intellectualize it, whether or not we can intellectualize it. We know there's a knowing within each person's body. And I feel my theory is that it is our fascial, that consciousness. If someone's staring at us, we can feel it, right? So it's that same like spidey sense. When you're in the room with someone who's safe for you, your fascia will relax. And that's my like passion. I love that. I'm like, yes, I am doing everything I can to be a safe person for my clients first and foremost before I ever touch them. Because if I touch them and they don't feel safe, I can't really do my work.
So I want to bring this up. The reason I'm bringing up safety is I want everybody to actually take a note of this part of the conversation. I feel like one of the reasons that a lot of us are staying in the fetal position in various parts of our body is because we don't feel safe.
Yeah.
I mean, I really want you guys to really think about your own personal, rate yourself right now. Okay. And if you feel comfortable, type the number in. When you say, what's my level of safety I feel in my life? And safety can mean a lot of things to different people. So whatever it means for you, like from 0 to 10, it's like the highest level of safety. What do you feel like is like your safety level? And it could be something like physical, right? But it could be emotional. What's your emotional safety level with the people, with like, let's say your primary relationship? Or you can even look at what's my safety level, what's my safety level do I feel in my profession, in my job? What's the safety level I feel? Do I feel like my home has safe places, right? In general, and so start looking at these numbers. It's interesting, right? When was the last time you even asked yourself, somebody wrote 4, right? Kit wrote 4. I feel like when your safety level is like under an 8, okay, I feel like your body is going to want to protect itself.
Heck yeah.
It really does. And when your body wants to protect itself, what does it do? It's almost like what a turtle does.
Yeah.
It like almost like a turtle position, right? The fetal position is a very curled up, protected position where your back is actually shielding you with your vital organs on the inside for protection. Yeah. It physically protects you. It also protects what? Your heart from lack of emotional safety. Think about this. Even like people with TMJ, it's an active protection. Curling in, tightening it all, protecting it, protecting an orifice, right? A lot of these positions that we have with TMJ, chronic shoulder pain, right? Even chest pain, right? And even in a sense, back pain. A lot of these are a result of actually the desire to maintain safety or to get safety from a physical standpoint and emotional standpoint. So for me, it's really interesting is that when you have body work that's done, that's moving away from the fetal position to open you up, an extension, it's also an expansion. It's an expansion of, I think, your sense of safety. Like that's one of the things that's important for me was I realized until I felt like there was safety that I could actually unfurl my body, my fascia didn't want to release. Nothing in my body was ready to release. It was like, no matter how many massages I got, my body wanted to be like this. But having that, exploring, why is my number a 3 or 4 in safety right now? Where in my life am I feeling unsafe? What needs to be done to increase that level of safety? And even in my medical practitioners, when you think about your people who are your medical practitioners, what's my level of safety with my medical providers? I mean, you should write that number down right now. Like if you think about it, think of the provider that you have spend the most time with right now is, don't make it not about me.